Wake up.
Wake up.
Wake up!
Get up.
You get out of bed this instant.
And turn it on.
Glenn, Angel, and the Flying Dutchman.
The Big Show on Kiss 92.
Good morning, Singapore, and welcome to The Big Show. It is a Wednesday, and that's why we're welcoming Dr. Lee Khai Pin, Senior Consultant Paediatrician from Parkway East Hospital, to join us today. Good morning, Dr. Lee.
Good morning, Glenn. Thank you very much for having me on The Big Show on Kiss 92.
Of course, it's a pleasure.
It's our absolute pleasure.
Yeah. So we're going to be talking about children today.
Yes, my favorite and my pet.
Oh.
Okay, it was very interesting. When we started the show this morning, we go pediatrics. Till what age does pediatrics go?
I think maybe FD will also fit into the pediatric category.
Yes, on some days, yes.
On some days.
On
On some
some
days
days.
I do too.
Yeah.
It's a good question. It's an interesting question. I think it really does depend on the country as well as the hospital. I think it varies from place to place. I do know of some centers that take pediatrics all the way to include teenagers, all the
Okay.
way, and NS men to 16 or 18 years old. For our purposes, in Parkway East End or in IHH hospitals, we are taking up to 14 years
14,
old.
okay.
I see.
Because we were having the conversation, we
Yeah.
said, okay, maybe puberty, and then they're not considered under that pediatric umbrella anymore. But you still do see kids that
But
age.
some people go through puberty for entire lives. So.
we got a comedian this morning as well.
we do.
Hey, he does work with children.
That's true, yeah, you got to keep
So
us
he's
laughing,
good with
right?
everybody.
Yeah.
No, and your
Love
energy
it.
levels are really high. It's
I love it.
Okay, so both of you have had children.
Yes.
I don't have any kids.
Yeah.
Maybe you want to, ask Dr. Lee some of the questions that that you may have been thinking about all these years.
Well, I think as a parent, things like injuries and all that, things that you can see are a lot easier in that aspect than things that you can't. So, for example, things like fevers,
right.
and kids come back with all sorts of things when they go to schools and stuff like that, when they hang out with their friends and all that. So, are high fevers in particular dangerous, and how high is dangerous?
Yeah, I think fever as a general pediatric illness does create a lot of anxiety, especially in what I call the non-verbal or pre-verbal population, which are basically children less than 18 or 12 months.
Okay.
So it's very difficult. Like babies in arms, right? They cry over everything. So that's their way of communication. So if they need food, they cry. They need milk, they cry. And if they have fever and they start crying, so is that something worrying? I think as a general guideline, we do want to state that the peak or the height of the fever does not necessarily correlate with the severity of the illness.
Oh.
Right. Okay.
Yeah.
Okay.
Which means that while the general belief is that, for example, if the child is running a temperature of 40 degrees Celsius, as opposed to somebody running at 38.5, does that make the child running at 40 degrees Celsius sicker than the 38.5? I think we want to just emphasize that not necessarily so. I think what is important is after we manage to bring down the fever a little bit, how our children actually behaves. Are they back to normal? Are they quite normal looking? Are they still feeding, drinking, playing, and interacting appropriately with their parents or their caregivers?
Yeah.
Right. Okay.
Because it's very uncomfortable for a child who's running a fever.
Yeah.
I remember as a kid,
Yes.
right? I used to feel very uncomfortable when I came down with a fever, as opposed to now as an adult.
Because
now
I
it's
think
like
you can manage
fever is a
it,
fever.
yeah.
But as a child, it's so uncomfortable when you have a fever.
But it's interesting though, because as adults, right, we get a lot more affected when the temperature rises. quite
Health-wise?
high. No, that means when we are running, let's say, a temperature of 39 degrees Celsius, we feel it more. We feel a lot sicker. The man cold phenomenon. Sorry.
Oh my gosh.
Okay,
Let's not
no,
even
let's
get
not go
started
there.
on
That's
that,
right.
yeah.
Sorry. So, but you'll be surprised because I've seen kids like 14 degrees Celsius
Running
running
around.
around in the consultation room.
Oh.
Right.
They look a little bit flushed, but you come in, you don't expect that temperature. But when you then take the thermometer out, then you realize you're surprised that they're actually running at 40 degrees. But they
Wow.
were just like playing in the
Is
consult
it?
room.
Maybe that's the reason why they're running about.
No. I think they were sick, but I think they do deal with the viral fevers a lot better than us
Than
adults.
adults.
Yeah, I think somewhere along the way we have lost the ability to cope as
Okay,
That's
knock on
probably-
wood. I can't remember the last time my fever was like 39.
Yeah.
For me, it's like 38. I'm like, okay, that's a fever.
Yeah, me too.
They're like, oh, I'm starting to feel a bit hot. I think I need to stay home today.
Okay, let's continue to talk to Dr. Lee on The Big Show TV. Here's Tavlo with To Die For on Kiss 92.
So, staying with the fever thing, a lot of parents, kids get a fever in bed, fan blasting on them, or
Right.
cold shower.
Cold shower,
Bring the
Bring-
temperature down.
Right.
Is
Really?
that
Yeah.
what we should be doing?
ice pack.
Ice pack.
No.
Ice bath?
Absolutely no. But
No.
to be fair, I think if we move back like medical practice like decades ago, I've heard stories of children being dunked
In ice.
in
My daughter
very
was.
cold- oh,
yeah.
My daughter was. I took her to a
Right,
clinic, they
right.
dunked her in ice.
No, but he's like that lah. Dunk the kid in
No, I
ice.
didn't.
He
The
cannot
clinic-
sleep. Brandy.
No,
you know, things like that.
the clinic dunked her in ice because she was so hot.
yeah,
Oh.
and that was even before you have hashtags like ice like
Ice
I-
bucket challenge, the ALS. Yeah.
but on a serious note, actually, the colder we immerse that poor child in either a very cold environment, let's say air conditioning or a cold shower, I think the worse it gets for the fever because the temperature difference is
Changes.
too big. That's right.
So you're talking warmer is better.
I'm talking about a neutral, nearer normal body temperature kind
Environment.
of warmth. That's correct. That's correct.
Yeah, because if you think about it, when people trek up, say Mount Kilimanjaro or whatever, they drink cold water because it's closer to the body temperature than warm
Right.
water. You don't drink a hot cup of coffee to warm up.
Yeah.
They have
It's
to
like,
keep
I
it
love
close.
having ice cream in winter.
There you go. There you go.
Yeah.
So,
for example, right? I think one of the, I mean, in Singapore, okay, thankfully we don't dunk or immerse children in cold water as part of the fever management anymore. But just to cite, for example, we do use a fair bit of air conditioning.
Okay.
So if, for example, if my child is running a temperature at 39 degrees Celsius, if we were to set the aircon really cold, let's say at 22 even, the temperature difference is very big. So I'm running a temperature of 39. There's a 22 degree room that I'm in.
Yeah.
And physiologically the body would respond by shivering.
Yeah.
Oh,
Because I
right.
feel
Okay.
colder.
Okay.
Okay.
And unfortunately, shivering is a mechanism to generate warmth.
heat. Right.
That's right.
Okay. So what? Okay. So 39. What should be an appropriate temperature then?
I think we would generally recommend that the child running a high fever be placed in a room,
Yeah.
ventilated, just room
Oh,
temperature.
right, okay,
Just if you
windows
could throw the
open.
windows open.
Right.
Yeah.
Fan
If you
is
could have
okay.
if you could have a fan blowing, like circulating air in the room,
Right,
but not
directly.
directly,
Not directly on the child.
Yeah, I mean,
Okay.
but then again, there are children who are really uncomfortable because
Yeah.
they're so used to, for example, sleeping in an air-conditioned room,
Yeah.
like most of the time. Then we would just advise parents to raise the temperature
Hmm.
of the aircon, for example, to like 26 if
Yeah.
you could, or
Yeah.
27, and just put the fan speed at its lowest.
So you want the child to sweat
I want the child to
because that cools the body down,
to
right?
be as normal body temperature as well
Okay.
as possible.
And
Yeah.
sweating is okay.
Yeah. Sweating's okay.
Sweating's
Sweating's
okay.
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 Yeah.
Usually, once you start sweating, it's
That's
like
a
you're
break.
on the way to getting a bit better.
Yeah,
already.
but conversely, I wouldn't again blanket. Sorry.
Of
Yeah,
course.
yeah,
Yeah.
yeah.
Because that's the other extreme. Because one extreme was putting them in cold water.
Yeah.
The other extreme was wrapping them with layers
Like a
until they
burrito.
sweat. So I think a midway, kind of middle ground would be
Right.
ideal.
Okay.
Yeah.
Okay.
Okay.
What
It's
about
so
like
hard taking care of children.
It is.
It is.
So cold patches and all that, like fever patches that which they sell at the pharmacy. If any parent wants to DIY this
Yeah.
situation at home before taking them to the doctor, what can they do
I think-
besides what you mentioned?
Correct. So physical methods that we described
Yeah.
earlier. Secondly, pharmacological methods, meaning through medication.
Okay,
If
like your
there are-
Panadols and
That's
stuff.
right. Yeah. So paracetamol, ibuprofen, common over-the-counter drugs, as long as the child doesn't have a drug allergy and it's suitable for the child. Then thirdly, if you come down to the patches, I think as long as they make the patient, and in this case the child, feel a lot more comfortable, it's okay to go ahead.
Okay,
Okay,
okay, okay,
okay.
I
fantastic.
think my mom was awesome. No?
Yeah,
She was
of
like a
course she is.
gangster back then. In the 70s, I would have a fever, right? She would buy me ice cream. As long as I don't have like a cough
Cough.
or whatever, she would get me like a nice lolly. and just
To cool
you
you
know, and
down.
I would love it.
Of course.
That would be something that I look forward to every time I have a fever. She would get me an ice cream. I would have to tell her like, you know, I got no cough. You know,
Even
Can I
if
have
you
an ice
felt
cream?
something,
and I
right?
always feel better. I always feel, you know, a little
Bringing
bit better.
the temperature.
Is that recommended? For
I think-
for kids.
I don't know if I had ice cream in the 70s because I was born then too. But I clearly remember the
The
ice
wafer?
things. No, the popsicle. Well,
Oh, popsicles.
Icicles,
sorry,
like
they
icicles.
quite sung pao in previously, but
Yes,
basically
yes.
they were chilled little like just chilled ice,
Ice,
flavored,
yeah.
put into the
Yes.
freezer.
Freezer,
Yeah.
yeah.
I think there's some value in that because it also helps with the hydration. I mean, okay, firstly,
it melts, right?
That's right. So if it makes the child happy, do it. And number two, it also helps with the hydration if the child is already
Not getting enough
not,
water.
not feeding properly during that period of
Right,
time.
right. Okay,
So it's
let's go
like
back on
ice
air and
chips, almost like
continue
ice
this
chips at
conversation.
hospital.
Right, that's correct.
Yeah.
Flavored ice chips.
Ice.
So nice.
Kiss 92 traffic.
On the TPE towards the SLE, look out for a broken down vehicle. This is right before the KPE MCE exit. Also on the PIE towards the airport before Kallang Way, a vehicle has broken down there. And finally, look out on the TPE towards the SLE once again after the Pongal Road exit because an accident vehicle has been reported. Wherever you are today, stay safe.
Welcome back to The Big Show and The Big Show TV. It's Glenn Angel and the Flying Dutchman. Our guest for today is Dr. Lee Khai Pin, Senior Consultant Paediatrician at Parkway East Hospital. And we've been talking about fevers.
Yes, we have been talking about
Interesting
fevers.
enough, your mum had a kind of remedy. She would give you
Ice cream.
Ice cream.
ice lollies. So
To make you feel better as
to
well.
make you feel better, maybe help you cool
As
down.
long as I don't have a cough.
Okay, so
She
just
would
before
always
we
say.
get into other topics, there's one more grandma thing. I just want to check from a doctor's perspective. Starve a fever, feed a cold.
Right.
Is there any truth in that?
Is there anything behind that?
I just want to clarify when they say starving a fever,
Yeah.
it means not giving, like not feeding.
No, when
No,
when
it
I
means,
No,
it means
yeah.
it's a minimal food.
I interpret it as starving a fever just
Right.
meaning regular eating, and then feeding a cold
It
means
means
eating
you're
more
pushing
because
it.
you're trying
Yeah.
to.
I still don't
gain
understand
your
all these
strength.
sayings,
Yeah.
actually. Sometimes you'll come up with all these things, right? I'm
No,
like,
this is
okay,
all
what does
stuff-
it mean?
This is all stuff that my mum
No.
told me. You starve a fever, you feed a cold.
Yeah.
To be fair, I've heard of the saying before, but I just wasn't as clear
Yeah.
as what it meant. But
Yeah.
I think it would be very important to keep the child hydrated.
Yeah.
Regardless of whether that's just a fever or just a cold.
Yeah.
And unfortunately, we do know that we can get both at the same
Yeah,
time.
yeah,
Yeah.
yeah,
You can
yeah.
get a fever and a cold.
And a cough
And what do you
and
do? What do you
everything.
do?
Yeah.
You starve the child half the time and feed the child the other half. But I think concepts-wise, we would want to encourage that the child be hydrated. Small, frequent feeds regularly. Keep the fluids going. If the child is happy to still eat and drink, especially eat, can go ahead with solid foods. As in, you
But
know,
if they have no appetite, which you usually don't,
Exactly. So we'll just emphasize the fact that please keep your child well hydrated. Lots of fluids, a variety of fluids. It could be water, it could be juices, it could be milk.
so
it could
things
be-
like smoothies might work as well, making
Yes,
it a bit
yes.
fun for the kids.
So not
Absolutely.
so much ice cream,
Absolutely.
something else, like maybe
More
a cold,
nutritious,
like
yeah.
a cold drink, which
A
is
smoothie.
nutritious.
Well,
Yeah.
I think a couple of spoonful of ice cream
Will not harm,
it's
right?
not
Yeah.
harmful. And again, if it does cheer the child up during a febrile illness, right?
Right.
Please help make the child happier.
Yeah, yeah.
But once again, that is if your child does not have a cough. But
Yeah.
let's talk about coughs
Coughs.
Yes,
now.
yeah.
Since I've mentioned coughs.
Let's do that.
So some kids have a cough that just doesn't go away, and parents get very, very worried.
Right.
Should they be worried if it's a prolonged period
I
that
think-
their kids
I
are
think
coughing for?
Cough is something that bothers quite a few of us. I mean, not just children, but I think including adults as well. And I think the recent COVID pandemic has also thrown light on things like long COVID illnesses, prolonged coughs, and things like that. Now, but coming back to my subject, I mean, to children, I think one important factor is whether the cough is accompanied, for example, by a prolonged fever. Because obviously that would make it a lot more worrying. So if I have been coughing for 2 weeks and now I have fever for 7 days, I think it's important to make sure there is no serious underlying illness. For example, like a bronchitis or pneumonia. Similarly, during the period of cough, it is also very important to make sure that the patient or the baby is not breathless, because that would make it an emergency or make it an urgency for the child to seek urgent medical consultation. But if you then say that, okay, there's no fever, the child wasn't breathless, the child is still feeding okay, behaving, etc., then very often when we analyze the cough itself, there are two components to look at. So one, is it an infection that's just taking a long time to go away? The second component is looking at whether there's an underlying allergy or an underlying allergic or inflammatory reason for that cough itself. And very often when we ask parents questions or we examine the child, these are the things we look out for to help us define the problem better and to treat the child better.
Okay.
All right, we're speaking to Dr. Lee Khai Pin, Senior Consultant Paediatrician at Parkway East Hospital. We'll continue to talk about your child coughing, and if your child's been coughing for a long time, could it be something else
worse,
that we should be looking at? It is 8:14.
Kiss 92 time check brought to you by.
Okay, FD.
Yeah, I know a lot of parents, and it's because we don't know medicine. I used to worry about it when my kids had a long cough. Can a long cough lead to an asthmatic problem?
I think very often it's like a question of chicken or the egg, which came first. I would prefer to state that I think some of us do have what I call asthmatic tendencies or genetically predisposed to it, because we know that there is a genetic link for allergic diseases such as asthma. So if my parents, unfortunately, let's say were both asthmatic, then obviously my risk of being asthmatic is much higher, and more so if my siblings, or let's say my elder siblings were asthmatic, then my risks are again higher.
That's so sucky,
one.
right? Why?
It's nature versus nurture.
I didn't ask for this.
He has asthma.
Yeah, I do. Yeah.
We're not PDPing on air, right? That's fine, right?
No, we're not. It's fine. It's fine.
So the other factor is, of course, environmental factors. We do know that in developed countries, we do know that there are various theories behind it, but we know that the allergic diseases are on the rise, which means that if you look at the local prevalence of asthma in Singapore now versus, like 30, 40 years ago when we were a lot less industrial, a lot less urbanized, it's probably much higher now.
Okay.
Yeah. So I would, sorry, going back to the question that you posed earlier, I would say that if there is a child or there's a patient with prolonged cough, I think it is important to again evaluate through a history, an examination, asking about family history again, to find out if actually the child does have asthma, and this is how he or she is presenting. I don't think it's the long cough leading to the asthma, it's whether the prolonged cough is itself is manifestation of an asthma
right,
itself.
Okay.
That's
Right.
What about things like wheezing? Because I mean, even
That's
I
right.
once in a while not suffer, but I wheeze. Maybe I've got a cough or a cold. But it happens in children as well, and sometimes for a prolonged period. Should parents be worried about that? And what causes it?
Right. I think wheezing itself as a sign would need some form of medical evaluation.
Okay.
Because it usually suggests that there is already some difficulty with breathing. The air passages are a bit narrower, and as we force, as we breathe, or when we breathe out, the air is made to move through a narrower passage, and that produces that wheezing sound that we
right.
pick up.
Got it.
So the fact that the air passages are narrower already, that itself is something worth evaluating.
Are they is it correlated to asthma? Wheezing?
So we do know that a lot of, or rather a large proportion of asthmatic patients, both pediatric as well as adults, may present with wheezing. But there are also other asthma presentations that comes with prolonged cough, for example. Essentially, but I just want to emphasize the fact that just because a child wheezes doesn't necessarily mean that the child has asthma. That's
Right.
That's right.
Right.
It could.
More often the opposite. Asthmatics will more often wheeze
That's
than,
right.
than
That's
not. Right.
Yeah.
So
Okay.
can you, as a pediatrician, confirm the fact that the child has asthma, or would you have to refer to the child maybe to a lung specialist or something to determine if the child truly has asthma?
I think there are cases that are a lot more clear-cut. So as a general pediatrician, for example, I think I will be able to diagnose it,
Right.
especially, as I mentioned earlier, Sometimes it's a lot easier. I'm not wishing that the family has ill health, but the fact that the parents have asthma,
More likely than not.
their two earlier elder siblings already have asthma established, then
Okay.
it does make it likely that this third child who presents with the second episode of wheezing has asthma.
Right.
There are cases that are more challenging because they don't present with wheezing, for example, or they're much younger, or they present with a prolonged cough. In such cases where there's difficulty getting that diagnosis, we do have the ability to, for example, refer to a pediatric pulmonologist or pediatric respiratory physician to also help with that diagnosis.
Okay.
You know, for the most part, asthma, I mean, a lot of asthma patients use Symbicort, they use Ventolin, they use stuff like this, right?
Right.
How young can a child be to take this kind of medication?
I think the first question I would like to answer is how clear we are that the child is asthmatic. I think when they're infant in arms, that diagnosis can be quite difficult to
Too
make.
early?
Right, yeah.
Could be quite difficult to make. Not impossible, but just a lot more challenging. For example, to make a diagnosis of asthma in a 3 to 6 monther. Compared, for example, to a 2-year-old child.
Right.
With regards to the medicines that you were mentioning, most of them come as inhalers.
Yeah.
I think,
Yeah.
yeah, that's right. You're familiar.
I carry, yeah.
So I have a question. You're how long have you been a pediatric doctor?
I have practiced for about 22 years.
Okay, who would you say is more difficult, the parents or the kids?
I like children.
Yeah.
I love children.
Because I'm sure you've seen more than your fair share of parents
Yeah.
panicking more than the kids.
Yeah,
You know what I mean?
yeah. So I love children.
Yeah.
So I gave
don't
my
love the
answer.
adults so
no, I didn't
much.
say I didn't. but I think many would agree with me that children and babies are a much more livable lot. You can do a poll.
Fair enough. Yeah,
You can
that's
do a
true.
poll.
After your poll and tomorrow.
Yeah, but I'm sure the results can be overwhelming. We do know some people are not as fond of children, but I think
Yeah.
the vast majority of us are.
You have to be, right?
Yes,
I mean, to
but-
pick it.
But the parents are, we want to be on the same page. We want to be on the same side as a parent. Our motives are the same, or rather our agenda is the same. We want to get the child better.
Yeah.
We want to learn how to work with the parent to get the child better. And that's part of our job.
Yeah.
Okay, so we've spoken about fevers, we've spoken about coughs.
Asthma.
That could be asthma
Yeah.
or not. Let's touch on stomach flu and diarrhea, which is another concern, I'm sure.
Yes,
you
it
know,
is.
Especially
when
with
it
traveling
comes to
going around
parents.
now.
Exactly.
Everyone's traveling.
Yeah. So, how should one care for their child who comes down with stomach flu and diarrhea?
I think if the diagnosis is quite clear, then that means we can link it, like for example, I think one of the clearest situations when the whole family unfortunately has a meal together.
Okay.
And everybody
Has.
in the next few hours come down with fairly similar symptoms of stomach discomfort, including the adults, for example, vomiting and unfortunately diarrhea. I think if the diagnosis is quite clear and we're not dealing with any other worrying complications, then for the vomiting child or baby, it's useful to just start with small feeds. And I do mean fluids.
Okay.
So
Yeah.
small volumes of fluids, just given repeatedly, but regulating the volume very, very small. So for example, like 15 to 30 mils.
Wow, tiny.
Okay.
Yeah.
That's
Tiny
really
amounts.
small.
Yeah, that's right. But I mean, if the child were to vomit out everything,
The
that's-
liquid as well.
that's zero, you see. But
Yeah.
if we were to give, let's say, 30 mils, and we give it like 3 to 4 times over an hour, at least I can get 120 or 150 mils of fluids or
in.
milk.
This is to make up for the dehydration.
That's right. Yeah.
But
that's
what if they can't even hold that down?
That's correct. So even if the small volumes they can't hold it down, then unfortunately very often we do have to seek urgent medical attention.
Okay.
Where an anti-vomiting medication can sometimes be given
Okay.
to temporarily relieve the symptoms and to get enough fluids into the child to keep that baby or child still well hydrated.
Okay, because I remember every time I had, like, if I had diarrhea as a child or not vomiting, diarrhea, even with my kids as well, charcoal pills are the first thing. So for parents who are traveling with kids and the school holidays are here, what if they experience something overseas? They don't want to go to a doctor. You know what, something besides the small mLs of water or fluids can they do in the hotel rooms, you know, to keep their kids comfortable and not purging so much?
Okay, let's go back on
ask
air.
that, yeah.
Yeah.
Kiss 92 traffic.
If you're heading down Ang Mo Kio Avenue 5 near the junction of Ang Mo Kio Industrial Park 2, look out for an accident vehicle. Also on the PIE towards Tuas before Toguan Road's exit, a vehicle has broken down there. Wherever you are today, stay safe.
Good morning and welcome back to The Big Show and The Big Show TV. We've been having such a wonderful time speaking to Dr. Lee Khai Pin, who is the Senior Consultant Paediatrician at Parkway East Hospital. If I had kids, I would send my kids to you.
Yeah, for sure.
Yeah. Yeah. They're wonderful.
So, Doctor, we were talking about traveling. Our school holidays are on. Everyone's packing their bags and going overseas. And sometimes you may be unfortunate to come down with stomach flu, food poisoning even when you're traveling. What would a parent do in a hotel room if they didn't want to take them to the hospital or a doctor to manage the situation with a 2-year-old?
I think prior to the trip, right, it is quite, and this is quite timely because the school holidays,
Yeah.
Just
the November,
started, yeah.
December holidays have just started. I think it's useful to, and I do think most parents do nowadays, they pack like a bit of medication, not just for themselves, but especially for their children traveling abroad. Also because overseas, there are various regulations. It's not as easy in some countries to get medications like on the shelves, over the counter for their own child. So that's the first thing. I do have parents dropping in just prior to, for example, like a long trip, especially if their children or their babies are very young.
Okay.
Because the younger the child, the probability of getting an appropriate medicine overseas, like in a rushed moment, is going to be much lower. So you do pack. But coming back to Angel's earlier question, I think if these are medicines that your child or the child has been using, then it's okay to pack some of these along. And some of these could include the following. For example, there are probiotics that could help with diarrhea situations. There are anti-diarrhea medications. Again, some of these medicines can only be used in a particular age group and not when they are, like, again, infant in arms or when they're too young. There are also some anti-vomiting medicines that could be useful to pack along as well. But again, please have a conversation with your general practitioner or with your friendly neighborhood pediatrician to get some of these drugs sorted out.
So
Good
these
plan.
are prescription drugs. They're not off the shelf.
I think some could be off the shelf as well, but there are some, clearly, again, the younger the age group, the more likely they're going to be
Prescribed,
prescriptions.
yeah.
That's
Yeah.
correct.
Right.
Okay.
That's right.
Okay. So we've spoken about
There's a
Fever,
lot to speak
Asthma?
about.
cough, and then stomach flu and
Stomach flu,
diarrhea.
yeah.
Right.
Let's talk about, because I'm thinking about my good friend Andre Huden,
Okay.
Yes.
who has 2 sons who jump all
All
over
over
the
the
place,
place.
and when they were younger, they used to hit their heads and stuff like that. And I'm sure many parents have kids who have hit their heads before.
For sure.
All right. So, what kind of signs should these parents look for? That could be, dangerous, right? Most of the time, a kid hits his head, doesn't complain, everything goes about as per normal, right? But what signs could indicate that there is something sinister and that the kid should go for a check?
Right. Again, in the pediatric demographic group, is a very large range. We're looking at babies who, like, at 5-6 months roll off the bed, and that's also a head injury, versus a 12-year-old boy who might have hit his head during soccer practice, for example. So again, the approach to these two very diverse groups will be quite different.
Yeah.
But I think conceptually, what is important is that that child who has injured his head, or that baby, should behave like their normal selves as much as possible. I think for a parent who is familiar with his son, his daughter, I think this is one of the most important signs. Is he or she behaving like how he or she would have behaved after the initial trauma of that fall? Of course, we expect the 5-month-old who have rolled off
cry.
the bed to cry for a while.
Yeah.
Is the child or is the baby easily consoled? After that, is the feeding still as normal? Because the danger signs, or what we call the red flag signs, that we look out for. So, for example, drowsiness, crankiness, irritability,
Vomiting?
more
than normal, right?
Unprovoked vomiting.
Yeah,
That's right.
okay.
That means
Vomiting.
even without crying, without anything, I just keep puking out my last feeds.
Oh, dear.
So all these are signs or symptoms that we are not so comfortable with. Again, some caution with the pre-verbal age group.
You're right.
That's right, because a lot of the head injury symptoms have to be spoken out. That means I need to tell you, let's say I've injured my head. then I'll tell my dad, okay, sorry, I'm having a very bad headache. I can't see clearly. I can't balance myself as well as I could. I'm worried. But that's only when I'm able to express and communicate myself. So again, for the what I call the pre-verbals, which are the less than 24 months or less than 18 months, again, babies in arms, please be very careful in the age group because they can't communicate so well. They're just going to cry. They're going to cry.
And don't get irritated with them, especially after they've knocked their head.
I think parents who leave their kids in the care of other people should definitely talk to their kids or check their kids' heads if they unable to talk,
or at least
at that age.
because a lot of them are helpers as well.
Yes.
At least train the helpers.
You know
as
why?
much
Because
as
when I was
possible.
my mom told me she put me in the care of someone. She had to go and work and all that, right? So she would come home and I would have bumps on my head and all that. And I was like 3-4 years old. Of course, I mean I don't remember any of this, right? Which is why she says these days I'm not quite right.
I'm sure she blames everything.
In school, I never used to do well in mathematics, so she always blames herself. She said, it must be those bumps on your head.
Yeah, but I think with caregivers, we do need to train them a little bit, right? Do people bring caregivers into your practice to sort of tell them what they should be looking out for in terms of injuries?
I think it's interesting because given our current setup, our structure in Singapore, we do have a lot of caregivers, like domestic helpers who stay with the family as well. And because just like Glenn, whose mother had to work, so we do have parents working like
a lot,
full time. And in fact, some of these caregivers are actually very, very good. They know that baby or the child inside out, and very often we do get very useful information about how the child has done or how the injury happened.
Okay, good. That's great. Okay.
Just be very careful with babies.
Especially.
Well, thank you very much, Dr. Lee, for joining us today. It's been a pleasure meeting you and speaking to you.
Yeah, thank you very much for having me on the big show, and thanks a lot. Thank you very much.
Thank you.
We've been talking to Dr. Lee Khai Pin, Senior Consultant Paediatrician from Parkway East Hospital.
Thank you for tuning in to The Big Show's Good Morning.